Hello, my name is Peyton Pruitt. I'm a nurse practitioner with the Gastroenterology Department of Murfreesboro Medical Clinic. Alright, so you need a colonoscopy. If you need a colonoscopy, then you may be thinking what's next or what to expect. So, if it is a standard screening colonoscopy, you are 45 years or older, and you've been referred by an outside provider or a provider within Murfreesboro Medical Clinic, if it's standard screening, you will not require an appointment. One of our schedulers will reach out directly by phone, and they will schedule the procedure with you over the phone. If you are having symptoms such as blood in your stool or diarrhea, abdominal pain, weight loss, anemia, or if you do not have a primary care provider, an office visit will be needed. Once you have your office visit and you meet with a provider and they decide that a colonoscopy is necessary, then you will meet with a scheduler. Once you get to the scheduling part of the colonoscopy, again, you will meet with a scheduler. They will look at your schedule based on doctor availability, and they will try to pick a date and time that is most convenient to you. Once you schedule the colonoscopy, the scheduler will talk to you about things to expect, such as what time should I arrive for my colonoscopy? Where should I go for my colonoscopy? They will also talk to you about your prep that will clean out the colon for a good exam. We'll talk later about what to expect for the preps and the specific preps that we offer. Once they talk to you about the date and time, where to go, the prep, they will also talk to you about various medications that need to be held. Now, we will also do this in clinic, so medications that thin the blood or that you take for diabetes or weight loss, some of those medications will need to be held, and that will either be discussed in your office visit or will be discussed with the scheduler, so you'll know exactly what medicines you need to hold and what medicines you will continue to take for the procedure. If you are on medications that are blood thinners such as anticoagulants or antiplatelets, we will send a cardiac clearance or a clearance letter to a cardiologist, neurologist, vascular surgeon, whoever prescribes your medication. We will send a clearance letter to them to get permission to hold these medications. Once we receive the clearance letter back from your provider, we will reach out to you via phone or portal message and tell you exactly when to stop and start the medication. The reason that we will have you hold medications that thin your blood is to prevent the risk of bleeding during the colonoscopy. So again, you do not stop them until you hear from our office, and we'll give you exact instructions of when to stop and to start based on the provider's recommendations. There are some diabetes or weight loss medications that we will have you hold before the procedure. We will talk to you directly about these. This is not every single medication for diabetes, it is only a specific drug class. So if you're taking medications for diabetes, we should have already reviewed your med list, or we will review your med list at the time of your visit or the time of your scheduling, and we will tell you exactly which medications need to be stopped and which ones need to be continued. For medications, the schedulers will talk to you exactly about which medications can be taken the day of the procedure. They will give you a list, and they will tell you they can be taken the morning of the procedure with a small sip of water. So when you schedule your colonoscopy, again, they will tell you which medications should be held and which ones can continue to be taken before the procedure. The colonoscopy itself does involve anesthesia. That means that you will be sedated for the procedure. Because of the anesthesia, we do require a driver who is 18 years or older to stay on property for the duration of your exam. So they'll need to check in with you, they'll need to stay on property, and then of course they'll need to be available after the procedure to drive you home. And again, this is because of anesthesia, and you are not able to drive or operate heavy machinery after anesthesia. So again, someone 18 years or older must be present for the duration of your procedure. So we always have questions about what you should eat or drink before the colonoscopy. We recommend that 3 days before the colonoscopy, you start consuming a low residue diet. We also recommend that you start hydrating very, very well, and these things will help the prep go a lot smoother and easier. The day of the colonoscopy, you will start a clear liquid diet. On the day of procedure, we recommend that you wear comfortable, light-fitting clothing, that you remove all jewelry, that you bring a photo ID with your insurance card, You also bring any insulin or inhalers that you may need. If before your procedure you have a medical event such as you are hospitalized, you are diagnosed with COVID, or anything that could change your medical condition, please reach out to our gastroenterology department to ensure that it is safe that you have your colonoscopy. So for example, if you schedule your colonoscopy and between the scheduling date and the procedure date, you have to go to the emergency room, or you're hospitalized, or you get put on a new medication, please reach out to our office to make sure that it is still safe that you have a colonoscopy, and make sure that we don't need to have you hold any additional medications for the procedure. All right, so you have your colonoscopy scheduled, you have your prep instructions, you know what to do for medications. The day of procedure, when you arrive to our facility, of course you will check in. We tell everyone to expect approximately 3 hours from the time of check-in to the time of your departure. Of course, this could take a little less, it could also take a little longer. We tell everyone to expect approximately 3 hours. The procedure itself is approximately 25 to 30 minutes long. Again, you will be given anesthesia during your procedure. This means that you will be asleep for the procedure, you will not feel anything during the procedure, and you will not hear anything during the procedure. During the colonoscopy, we'll be looking for things such as a source of your symptoms, polyps, or colorectal cancer. If polyps are found during the procedure, we will remove those polyps. If there's any mass or otherwise concerning findings, that will be biopsied. Once you wake up, you will get a preliminary report from the physician, and he will tell you what he found. If there's anything biopsied or any polyps removed, that will go directly to pathology. This can take several days to be reviewed by a pathologist and returned to us. As soon as we receive the pathology reports and it's reviewed by a physician, someone in our office will call you and discuss the findings with you. They'll discuss any needed treatment based on pathology, and they will also tell you when your next screening colonoscopy is recommended based on pathology. All right, I hope that this makes you feel more comfortable having a colonoscopy with Murfreesboro Medical Clinic. If you have any additional questions, please reach out at 615-867-8070 or visit our website at mmclinic.com.